Okay, so last week we left off, we started talking about structures in the mouth. We'll continue with that. The reason we have mouth up there for better part of 3 days is we'll actually watch part of an oral surgery to where and it is quite an older one, probably going back to the early 2000s, but the material in there would still be just as relevant then as it is now. If someone, in this case it's a young boy, if someone has a cleft lip, cleft palate, is that something can that child go on to lead a normal life even without surgery? Well, they can, but there's a couple things that happens for us that we take for granted. We just don't think about on a daily basis. One, if that cleft palate, okay, in other words, the top of the mouth, if that is not surgically corrected, can you think of a couple of annoying, let's say, side effects that child, Jackson I think is his name, that would have to live with on a daily basis? What might that be? With a cleft palate. Now remember, that's a hole on the top of the mouth. Okay, so it's not that he can't swallow things, it's not that he can't eat, but if there's a hole in the roof of the mouth, where's that liquids and solid particles going to go? That it may go up into his nose, especially that of the liquid portions. I probably did this when I was making that. Um, yeah, when I was making that up on the board over there. Okay, this is probably where we start. We're past this then. Okay. Yeah. Okay. All right. So this is where we start, or this is where we left off? Okay. Fair enough. So, and then another side effect would be sound just will not resonate. Air, your lung goes through your larynx, okay? Then it travels through the mouth. It resonates inside your mouth oral cavity. If there's a hole up there, it just would not be able to understand him. Okay? What's up with our pencil sharpener again? A student is only as sharp as his or her pencil. So, okay, fair enough. So now, what do we mean by the pharynx? The pharynx is a scientific name. So what does that mean? Where's that located? Yeah, your throat. So it doesn't say after the throat or after the pharynx, it says before that. So it's everything where you chew, you talk, all of those take place in where the sound resonates in your oral cavity. Where all your teeth are located. And one of the things that happens, should you be unfortunate to lose a tooth now, why is that a problem? Yeah, because it won't grow back. You have to have that surgically implanted. All right. So oddly enough, when we do get to, we really don't think of the cheeks as muscle tissue, but in certain cases, some of you people aren't using your zygomaticus muscle, in here. Didn't say everybody. Some people don't. So the zygomatic arch is right below your eye sockets, so it's approximately about right here. So there's muscle tissue that attaches to that structure, and it pulls your cheeks and lips up. So what does that allow you to do you think? Just like you do every day when you walk in here. We're always smiling because this is the best room in the building. So otherwise, if that's not the case, wouldn't you question why would you want to be in here for 2 hours then? Because there's lack of choices. Okay, and you're probably gonna need it. Okay, I agree. But one aspect, if you don't like it at this level, are you gonna like it at the next one where you go faster and it's even more difficult? Fumble. Uh, that's what happened. I've asked for more clips, but because we ran out, that's rather unfortunate. Okay. That statement was just so shocking. Okay. How are we gonna address that water spill? Is gonna need probably some towels. Okay. back at it. Now, so of these, we certainly know that if you inadvertently bite your lip, yes, that can start bleeding. Um, Drinking something hot or something cold, certainly know it's more beneficial. I shouldn't say beneficial, but to burn your lips than it would be actually burn your mouth, because this is on the outside. The inside, you'd be more prone to infections, I would be led to believe. You might think, well, what about out in the open air? Well, that might be true, but the air is probably dry. It's moist inside your mouth, where bacteria and viruses would really like to, or more so bacteria would like to thrive. But that's something that your saliva does a pretty good job of taking care of that, of keeping your mouth clean, just because there is those chemical components in there. Okay. And again, a lot of these motions that take place during chewing, it's just something that, again, we just don't think about. And your mouth is certainly, or excuse me, your tongue is certainly important in that aspect. Because should you not have a tongue, if that area is voided, well then there's no way you'd be able to chew all that food. It would just start swashing around, and you would not be able to break it down mechanically. And if that structure known as the frenulum was not there, what might possibly occur while you are sleeping? What can the tongue possibly do if it was not attached to the floor of your mouth? Yeah, it could flip backwards and you could possibly asphyxiate or suffocate. Okay. Okay, one more, and we'll see one. Now, it's just the way that we're designed. There's really no reason that I can really think of why the anterior or front of your mouth has skeletal tissue or a hard palate, and then the back portion is soft. Other than possibly chewing, and then maybe when swallow, it has that ability to expand a little more because it's soft rather than a bony, hard plate. And anytime you roll your tongue, okay, you can certainly feel those tiny structures known as papillae on there. And what different types of tastes do you suppose are in those taste buds? What can your tongue sense? I think there's 4. Sweetness, sour, bitter, spicy. Sure. Maybe there's only 3. Okay. Okay, so perhaps tomorrow we'll get, well, where are we at here? What do we got next? I think that's a good, you know, from one author to the next, Sometimes the chapter numbers change. That is a good question. Let me look, because I keep saying 15 and it probably says 17 on your paper. Let's see. Chapter 17, yes, not 15. Okay. All right. That's all I got. We'll catch up to you next time.